Thank you so much, Doctor. That was very informative, and it really puts things into perspective. So now we're going to begin our Q&A, and I just want to go over a few things for the audience. We don't take questions directly from chat. What we do is we request that you raise your hand in Zoom. If you're not familiar with that process, you just need to go to the reactions button, second from the right at the bottom of the Zoom window, click on that button, and then click on the raise hand function in the menu that pops up. When I call on you, just please state where you're from and ask your question. And we just ask that your questions are brief and on topic. And I see we got a few hands already raised. So I want to, go ahead and get a participant here. Debbie, where are you from and what is your question?
Hi, yeah, it's Debbie from Duxbury, Massachusetts. I have a couple of questions, if that's okay. First of all, just back on the biotin that you were talking about, and if you take so much and then get your thyroid test, would that indicate that, what does it make your thyroid medicine not work and they're going to prescribe more, or does it look like it's working too well and they prescribe less? I'm like a little concerned because I've been on biotin and I just checked it and it's like 1,000 a day, and I never adjusted that for like my tests, and I'm going to see my doctor soon in a couple months. I'm going to cut it back because I have thyroid. I'm on that stuff.
Well, a couple of things. If you're actually trying to regrow hair, you're probably going to want to take a higher dose.
And if you actually, what's going on?
What's that?
Sorry,
Okay. So if you're actually trying to grow hair, you're going to want to take a higher dose. And if you actually have hypothyroidism and require medication, you're going to want to stop taking it before you have a blood test so you get an accurate reading and you're not over or under medicated. So in the case of, I don't have hypothyroidism. So if I were taking, I don't have anything wrong with my thyroid. So if for whatever reason I had a doctor's appointment on July 1st, all right, and I'm taking biotin, there's no reason to stop taking it because I would just tell my physician, I don't need to have my thyroid tested. And if it is included in this lab test you're going to run, it doesn't matter what it says. I know it's going to be skewed because I'm taking the supplement right now, right? So in your case, I think what you want to do is up the dose if you're trying to grow hair with it. If you're not trying to grow hair with it, I can't fathom what its usefulness would be. But if you are trying to grow hair with it, a higher dose would be better, and then just stop taking it so that you get a good reading on your blood test when you get your thyroid panel back.
I'm so sorry. I had to take care of something. So there you go. Now we're even for the video thing. Yes. So a lot of people gained 15, 20 pounds during COVID. How much was that a factor in people's perception of their poor health after COVID?
A huge perception. First of all, if you gained a lot of weight, most people lose weight when they have the flu, all right, because of the vomiting and the diarrhea and all that sort of thing, if you had a severe case of it. So if you actually started gaining weight after that to the place where you have 20 pounds to take off or whatever, every pound of fat that you carry that you don't need is producing inflammatory cytokines, right? So a generalized level of inflammation that contributes to almost any disease that you don't want to get. Plus the habits that lead to weight gain. You're either not exercising enough or you're eating too much fat. Eating too much fat enters your cardiovascular system and preferentially feeds pathogens in your gut and all that sort of thing. So weight is just a wake-up call that something's not right. That's what the way you treat weight. We don't want to shame people for being overweight, but we've gotten to a place in our society where it's considered politically incorrect to talk about it. We got to start talking about it. When you're carrying around a lot of extra weight, and a lot of extra weight is really 5 pounds is not going to hurt you, but people walking around with 10, 20, 30, 40, 50 pounds of extra weight, that is a health risk.
And well, along those lines, is there, talking about politically correct, there's an idea that you can be overweight and healthy. Is that a reality?
Well, I'll tell you this. Start reading centenarian stories online. You can read them till the end of days because a lot of people around the world really do live to be 100. Try to find a fat centenarian. There's not a single one I've ever seen. All right. So you're not going to, the more weight you carry, the more likely you are to die prematurely. And it's a marker for health. It's not about, I mean, people want to look nice. I've never met anybody who just is honest, who says, I don't care what I look like, right? But it's a marker for health. If you're carrying extra weight, something is wrong and you want to fix it. It's easier to fix a minor problem now than it is to fix a major problem later. And I have a theory, I don't know if it's true or not, but I would bet money it is, that from birth to death, everybody in this group will spend the same amount of time and money on health. I'm spending it on yoga and food and gym. I don't have to buy gym membership. I own a gym, but I'm investing the time and money in health. Some people are investing the time and money in sickness. My mother did that. My father, when we got the bills for my mother's illness, the last couple of years she was alive, my father provided a lot of supplemental things for her, like 24-hour nursing and all that kind of stuff. You know, Medicare paid $1 million. My dad paid $1 million. That's a lot of money. It's a lot of money, you know, and for a awful quality of life. I wouldn't wish the last 15 years of my mother's life on anybody, including people I don't like. Okay. So just think about it. You're going to spend time, you're going to spend money. What are you going to spend it on? Spend it on getting yourself healthy and stop looking in. And I know from experience, because I used to be fat. Nobody here knew me when I was fat. But I remember when I used to think, well, you know, I took off 10 pounds, I'm good. No, I wasn't. I was still the size of a house. Well, I'll wear black. It makes me look thinner. When you're the size of the house, black does not make you look thinner. I'm just going to tell you right now, it does not help, right? You know, so I had to get honest with myself at some point in time and say, look, this is not good, you know? And I'll share this with you. I haven't told a lot of people about this, but a person I went to high school with sent me a picture of recently of when I visited her in Florida. We lost track of each other after this, but anyway, a couple, 3 years after high school, I visited her in Florida for a couple of days. So it's the two of us sitting around the pool. And she said, I'm sending this to you not to make you feel bad, but so you can see where you came from, you know? And I was huge. I couldn't believe it. I didn't even recognize myself. It would, if you saw this picture, it doesn't even look like my face, right? And I remember back then thinking, it's not so bad. What a delusional mind I had at that point in time. So I kind of went off on a tangent there, but we just got to get to the place where we think it's okay to carry extra weight, not because of some judgment about your appearance, but because it's just so detrimental to health.
And loss of smell, which you touched on, was obviously a major thing, especially with the initial variant that came out. Everyone, a lot of people have lost their sense of smell. Many people have not regained that. Are there other things, like you mentioned, the salt caves can remediate that? Are there other things that may have contributed to people losing their sense of smell, or does the research show that the loss of smell was in fact due to the COVID virus?
It seems like it was due to COVID, and it seems like it's related to the spike protein, which is how it was engineered to be so infectious in the beginning. I mean, that's truly what happened. Here's what we've noticed. This is another one of these things that appears to get better with time. It's just over a long time. All right. So I was just talking to a yoga student after class a few days ago who had this happen. She was in great health. In fact, that's the only residual symptom that she had from COVID was the loss of smell. And what she told me is what I'm hearing from a lot of people. So no smell, then a sense of smell that appears deranged, like I'm smelling something, but it doesn't, like I'm smelling something that has cinnamon in it, but it doesn't smell like cinnamon to me. And then gradually it is restored. I think you can speed it up with the salt caves, and you might be able to speed it up with something like Flonase, but we don't know anything at this point in time that works better than that, time and those things.
Great, thank you. Our next question is coming from Rochelle. Where are you from, and what is your question?
Hi, I'm Rochelle. I'm from Long Beach, and I have a couple of questions. Me and my husband both contracted COVID, and I had a very mild version, lasted a few days. My husband had it twice, and he had it more severe the first time. He was on the couch for like 3 months. But so long term, and we're both health conscious. I just want to mention that we both plant-based diet, exercise, no, conditions, no chronic conditions. So what he has is this cough. We call it the COVID cough. He has this cough every morning.
Mhm.
And he can't seem to get rid of that. And I found like respiratory, I don't have the stamina I used to have. You know, I
Mhm.
used like if I run, anaerobically, I run out of breath. So I'm just wondering what you could suggest for that or why that's still happening.
Well, it's difficult to say without looking at your health history because I'm not saying that you're not telling me the truth. Please don't misunderstand what I'm saying, but we get people all day long who tell me that I can't understand how this happened to me because I'm in good health and I do all the right things. And then when we take a look at the actual story, it's not quite all the right things, right? So I don't know. But what I would tell you is two things. Number one, you may have to rebuild your aerobic fitness just the way you built it in the first place. In other words, when I'll share this with you, I got dared. I was not a runner. I got dared into running a marathon when I was on stage with my then boss in front of 5,000 people. And I said I wasn't a runner. And he said, well, apparently you don't think you can do it. And I said, well, I can do it. So anyway, having never run before, I went to a park where they have it marked, what the distance is. I made it a quarter of a mile running. I fell into the grass. Honest to God, I thought they were going to have to airlift me out of there by helicopter. That's how much wheezing and shortness of breath. And I did later that year run the New York City Marathon and finished it. So my point is that coming from a point of no aerobic capacity at all, which is where my starting point was, I got to the place where I could run 26.2 miles and walk back to the hotel and join my friends for dinner, right? So you may have to just go through that rebuilding process. And it's not fun. It wasn't fun then. And it's not going to be fun right now. The salt room may help your husband a lot, and neti pots and things of that nature. Salt halotherapy may clean that out. And an antihistamine might be worth exploring too. I would not do that necessarily. If you're going to start using some drugs of any type, I think I'd work with somebody on that. But the cautious use of a couple of drugs may not be a bad idea.